Time for Medical Monday. Dr. David Gossman is here with Baycare Clinic. We are talking about something a lot of people suffer from, sinuses, sinus infections, things like that. So first of all, start by telling us what sinuses are.
The sinuses are air-filled cavities within the facial skeleton. The sinuses communicate with the nasal passage via small channels. In the healthy setting, the nose and sinuses function together. Air is able to circulate into the sinuses through these passageways, and mucus produced in the sinuses is able to drain out into the nose.
Okay, gotcha. So how do we know the difference between bacterial and viral infections? I know that this comes up so much when we go to the doctor, we think we have a sinus infection. Difference between bacterial and viral?
The biggest way that we use to define the difference between those two is duration of symptoms.
Okay.
In general, a viral sinusitis is present for a duration of less than 10 days. We consider a bacterial source when the symptoms have been present for more than 10 days or in a circumstance where a patient's symptoms have improved but then start to worsen.
Okay, what do you do for that? Do you get medication? Are there antibiotics involved?
Yes, well, the treatment options for sinusitis, the conservative treatment options include a variety of things. First of all, like any illness, rest helps the body recover.
Yes.
Hydration, keeping yourself well hydrated allows the mucus in the nose to be thinner and easier to manage. In some circumstances, nasal steroid sprays can be beneficial. Nasal saline irrigation is probably one of the biggest things that patients can do to help themselves.
What would that be? Are these like the neti pot things?
Yeah,
okay.
a neti pot is a good example of that. A saline rinse bottle, basically what it is it's a large volume sinus and nasal rinse that patients do 2 to 3 times a day while they're experiencing the symptoms.
Okay.
Lastly, decongestants can be of some benefit. These can come in an oral form that patients take as a pill or a topical nasal spray decongestant. It's important that patients realize when using topical nasal decongestant sprays, those should only be utilized for a period of 2 to 3 days.
Okay, so not the whole duration of having that. Okay, so what makes us get sinus infections? How does this happen?
Well, a sinus infection is caused when either a virus or a bacteria infects the lining of the nose and sinuses. This then produces swelling of the mucosal membranes. When these membranes swell, those drainage passageways block off.
Yes.
And then mucus builds up, and those are what produce the symptoms of a sinus infection.
Something so many of us suffer from. All right, Doc,
Very
thanks so
common.
much for being with us. For more information about managing sinus issues, just visit our website and click on the Wisconsin Tonight section. Well, it could soon cost you more to visit Wisconsin State